We are honored today to have this opportunity to be able to truly engage with our living past, to have with us Mrs. Margaret Larson, one of the 105 original nurses of the 50th General Hospital, who deployed to Glasgow from Fort Carson, Colorado. While in Glasgow, some of their training included lectures from General George S. Patton, Jr. Shortly after they arrived, literally on the beaches of France, wading through deep water, they had to march more than 7 miles on the hottest day of that year before arriving at Carrington, then Commercy, for the duration of the war in France. At maximum capacity, they had over 2,300 beds, over 2,100 inpatients, and the most busiest day of the year, they admitted over 500 patients during the Battle of the Bulge. Mrs. Larson?
After we arrived in France, we were all just kind of on a field where we set up tents for a little bit, but I was sent out on a surgical team with some surgical teams, and there were about maybe 20 or 25 of us that went out, and we went to Saint-Mère-Église, which is now is a big cathedral, I guess, there. Anyway, and we set up our tent hospital there and took care of the boys coming in from the front, and they just came in by the dozens. It was not pretty. But we were there for, I guess the surgical teams were there for about 3 weeks. And we were right on a little river that was running through France. And one day, one of the nurses and I just came out of our tent in the morning, and a little German boy was standing outside our tent with a rifle over his shoulder. He was more frightened than we were. We were all three very frightened. And he ran away. So we weren't hurt, and we didn't hurt him either. And we were there for, I guess, about 3 weeks, taking care of the boys who came in injured, and some of them that were very injured, they were taken, there was an airfield close by, and they flew them off to England or the United States. Well, anyway, we came back, and we were in, I think we went to Carrington. We were in tent hospital, and we took care of the fellows I worked in surgery. And it just was, day in, day out work. We didn't have any time off or anything. We just worked if you were scrubbed, you scrubbed until you were finished. Good. What was important about being a nurse was taking care of people when they were ill and seeing that they got better, giving them the best care we could. In those days, we didn't have all the things that we had to do. We had very few pharmaceuticals to give to them. And there were a lot of things in surgery that they have now that we didn't even believe would ever be in surgery. And a lot of the things that you put on wounds, we didn't have. We didn't have the bandages they have today. But I would think that, I hope that the nurses who have had to go to war have had a better setup and a better time than we did, where we all had to write everything out on paper and send it to the lab or send it to wherever it had to go. And many times we had to take it ourselves. And it was nothing for a nurse who had scrubbed all day. And the patient was put on the cart to go back to the bed, for her to have to take the cart and take them back to bed. Things are much different today. We had to
Yourself.
do everything ourselves. If the floor needed scrubbing and there was no man around to help you, you scrubbed it. And if blood was spilled somewhere, you cleaned it up. Oh yes, we had gloves.
Oh, okay.
But we did not throw our gloves away after we used them. We would wash them, and if they needed mending, we mended them, and then they were put in the autoclave to be. And I understand today they throw the gloves away immediately. But we used those gloves until they were practically nothing. I just think nursing is a great profession. You can do so many things from nursing. And you can teach, you can do lab work, you can do all kinds of things if you're a nurse. And you are taking care of people. Some nurses like to work in the obstetrics and see the little babies, and some of them work in pediatrics and see the poor children who are ill and those who get well, and that's a great thing too. Happy Nurses Week to all the nurses. Thank you. Give them the best care you can.